All right, welcome back. We are now answering your questions about COVID with the Moses Cone Memorial Hospital Chief Medical Officer, Dr. Jay Wyatt. This text person says, my granddaughter just got back from a weekend in Florida. She had one vaccine shot, but now she has bad cough and body aches. She took an at-home test and it showed that she was positive. What should she do now?
She should isolate. People who've been in contact with her should watch out for symptoms. She should still get her second shot at the time she normally would if she is asymptomatic. And then she should, depending upon her age, if she's going to school or whatever, probably not go to school.
This person is asking, is it possible to have memory problems or brain fog 6 months after having the infection?
It's possible. I'm not sure if I would attribute all that to COVID per se. But it's possible to have lingering symptoms of COVID, shortness of breath and chest tightness. That's more common specific to COVID.
Okay, this person is saying, I have to serve as a hostess for my cousin's funeral. I don't know the people there. It is an indoor affair. Although I have been vaccinated, should I wear a mask?
Resoundingly, yes.
All right, the next question is, I received a positive rapid test, but a negative PCR test, both taken at the same time. So which one should I believe?
It really depends upon the reason why you're getting the test done and if you're symptomatic. If we're getting it because of exposure, you can get false positive and false negatives on each one. The nasopharyngeal PCR test can be more difficult to get sometimes, and it may get a false negative because you didn't get an adequate specimen. So I'd repeat the PCR. And if the repeat is negative, I would say that you do not have COVID.
Okay. This person says, should a person with heart problems like an enlarged heart get vaccinated?
Yes, they should.
Any issues? Should they be talking to their doctor maybe before they do that, just in case there's anything they should be worried about?
They should talk to their doctor whenever getting any type of therapy, but they are a vulnerable population with heart failure, and to get COVID on top of that can be very devastating. So yes, they can. Now, one mild side effect of COVID can be myocarditis, but generally it is very mild if you get it, and that's normally in younger people.
All right, this person says, what is the most common underlying condition in the more severe cases of COVID?
So most common underlying symptoms in severe cases?
Yes.
Is that what they're asking? Generally, shortness of breath and chest pain. If you have those two together, it can escalate fairly rapidly, and so you probably need to get in to seek help pretty urgently.
This next person says, I heard with the at-home test kits that you will continue to test positive months later. Is that true?
It's possible to test positive for COVID even using the hospital PCR test for several months after you've contracted COVID. So up to 3 months is what we sort of typically sort of talk about as being the time period where if you get another test positive, it doesn't mean that you're reinfected, just means you have not, sort of cleared your viral load yet.
All right, this next question is, how can I get a replacement vaccine card? I misplaced my card. I had both Pfizer shots at the Coliseum.
If it was through Cone Health, you should be able to go through My Chart in Cone Health and get at least a electronic picture of it, and you can also probably get it printed somehow. If you got it through other forums, you have to probably go through the county if you got it through the county. But if you got it through Cone Health, you can't get it through Cone Health.
And it should be on the dashboard as well. You should be able to put in your name and be able to do that on the state dashboard. All right, so this question is, what if a person had COVID before and was asymptomatic? Will they always be asymptomatic if they got COVID again?
No, not necessarily. It really sort of depends on, which, where it starts to affect them. It's sort of a pot shot. You don't know if you're going to get really sick or not if you get infected with COVID.
So this person is asking, for those of us who are not vaccinated, should we go for an infusion of the Regeneron monoclonal antibodies? I know I didn't say that correct. You can say it correctly. Also, should have vaccinated people have the infusion?
So generally, you can get the infusion if you're vaccinated or not, if you're symptomatic, generally when early in the course of the disease. So you are eligible for the monoclonal antibody.
You are able to do that. All right. And so this person says, okay, I'm kind of trying to go through each one of those ones. They're asking, could you possibly get both of the shots and also the booster shot and still have a breakthrough case?
We don't have enough people who've had the booster yet to sort of know that, but I would suspect that you will probably still have breakthrough cases even once the booster is being administered more widely.
And then this next question is, why isn't eye pain and blurred vision recognized as a symptom of COVID?
Well, it very well could be a symptom of COVID depending upon, where the virus sort of tends to attack, but it's not one of the more common symptoms. It's just not recognized as one of the more common symptoms.
And this next question is, are there places to go to get the vaccine where people who have an anxiety about needles, someplace maybe where they come to the car to give a shot? I do know that there are some home shots as well.
There are some mobile clinics that are giving the vaccination, and they may do a better job of allaying that anxiety, but I think most healthcare systems do a great job of working with people who have that level of fear.
So come in and get that shot, although there are those mobile units as well, and so you can look online as well. We have some stories on that. Thank you, Dr. Wyatt. We so appreciate your time and your expertise. We thank you for your questions. If you missed anything at all, we want you to go back to WFNYnews2.com and take a look at our website. We'll have all of these interview segments there for you as a resource.